Good afternoon, Americans. Today is April 26th, 2020. My name is Guy Gleichman. I'm the National Medical Director for Optimal Health MD and also a senior clinical advisor with regenerative medicine at Synergy Rejuvenation in South Florida. This is the second update to our very important health advisory, and I want to bring you up to date on what has basically transpired from 3 weeks ago when we conducted our first introductory video, because we have now even more concrete evidence of what our finding was. And remember, that was, I pointed out to you that the most blatant compound error that unfortunately authorities in place could have done was, number one, as we've already established and is accepted by all of the top infectious disease experts, epidemiologists, and doctors, is that the number one blunder was, of course, delaying testing for 6 to 7 weeks before we could find out and get a handle on what the rate of spread and everything was going on. But the second most ideal way to advance the virus was to then take that whole massive public sector into a blind quarantine and then lock you down in the confines of a home, which is on average maybe 12 to 1,500 square feet, and lock you down for 14, and sometimes now it's up to 28 days. I encourage you, as I did before, to reverse your thinking, which is the same type of technology or technique that often researchers in labs and doctors and mathematicians all do to arrive at a solution. They have to sometimes reverse their thinking. They have to sometimes think, well, what does the virus like, or what does the virus need to advance, to then promulgate an antithesis to that, or a way to counteract that by figuring out all the avenues that the virus needs to advance. So if you incorporate that into your thinking, you will quickly deduct that what do we know? And I'm going to go by the known facts. We now, as of just this week, as the task force, he released this whole study where it minimizes the half-life from hours to literally minutes with the proper application of heat, sunlight, ultraviolet, temperatures involved, humidities involved. And I also want to encourage you to accept that this is a very fluid situation, meaning things fluid in such a way that not that the virus is changing, it's our understanding of what the virus does is changing, because we're in a learning curve, thus the word novel virus, okay? This is not following the same staple, the same characteristics, the same mechanisms of activation and victimization as previous coronaviruses. It's very different, okay? So we must first acknowledge that. Second point is to reiterate, as I stated, if you think and reverse your thinking along the lines of advancing the virus, then you would obviously avoid sunlight, okay? You would avoid the surface contact half-life, which is mitigated immediately from temperature and ultraviolet light. And so now that automatically moves ideal conditions for the virus is not at a beach, it's not at a park like this, it's inside the home, or inside an office, or inside, period, where they maybe have an HVAC system that is maybe blowing, okay, the various particles of the virus. And also, to best understand this, I want to reiterate, it's very important, because unfortunately, the public, whether it was meant to be, which of course we don't want to think that the authorities just neglected or overlooked the fact that they have incorporated in the public a subliminal thought that you're just safer at home. Safe at home. It's even a phrase on the big PSA that you see all over the television with Fauci and Dr. Bricks, and saying just stay safer at home and distance yourself. Well, now that we know that the virus doesn't discriminate, and it's human to human, you'll hear me repeat that over and over. It is not only stranger to stranger, or you can only get it from your grocery worker, or getting too close to your FedEx worker, or from your person at the office. No, no, no. It is human to human. And that makes the title of our video today, Space Management, the Final Frontier. That brings it directly home and right at your doorstep. The most important thing now going forward, and this applies to everyone in the world actually, is how we manage the 6 to 10 foot space that's between us as human beings. And you need to stop and really think about what that means, because if you doubt blind quarantines were detrimental and damaging, then I would tell you to look at the facts which we just extrapolated over the last couple of weeks. And we just took the top 10 states of the most populated, and we just simply plugged in the life of the virus, which is typically a 2 to 3 week cycle from when you contracted to when you're at peak symptoms, unless you're asymptomatic. You're gonna feel the peak symptoms of the coughing, and then if you get, unfortunately, because this virus is indiscriminate, but the reaction to it based on your personal immune system, your age, your physical status, your health status, if you've got any preconceived conditions, all react differently to the virus. And that's what makes it somewhat complex from a health worker standpoint and from the physicians that I talk to. But one common denominator is the same for everyone. And that's where this is a one-size-fits-all when it comes to the solution. And this is, again, without the benefit of testing, okay, is that distance is the one thing that can, pardon the pun, trump the transmission of the disease. If you are healthy and if you're safe and you're not infected and you manage to stay outside of that now expanded, as you heard, up to 12 to 13 feet as they recommend, then you can outrun the virus, at least for now. Why is that important? Well, predominantly in the third week of March, of the 10 states that we researched and checked on, according to the published numbers, this is by the infected rate that they know from testing and the subsequent death rate that is a result of that infection rate, we now know if you plug in the second to the third week, it is undeniable. We now know the evidence of what I stated 3 weeks ago is true, that the virus accelerated indoors within the homes in the second and third week. New York issued their stay-at-home order on 3/22. That means their peak date, which I call peak week, was the third week. And it's not a coincidence that on April 10th, they recorded their highest death rate out of the hospitals at 799 deaths that day. They also did a subsequent update to that because what was not told to the public, or wasn't being reported, in all fairness, was the death rate outside the hospitals or the death rate to COVID outside of the hospital that wasn't tested positive within the hospital. Those were just 799 deaths that were recorded according to what was tested positive in the hospitals. They then reported 4 days later, you can check this, on the 14th of April, in the New York Times, they did an article where they found 766 more people had been found dead in their homes in the preceding 3 days to that, where the tally was up, I forget the exact number of days, but it was over 1,891 deaths that week, specifically for a certain number of days in New York. Now, New York, granted, is a different demographic, obviously different exposure when you look at contact with the subways and everything else. But I also want to point out that it is not a coincidence that prior to the stay-at-home order on the third week of March, we know for a fact, the epidemiologists, authorities all agree, especially in gateway cities, I call gateway cities, those are cities that all have an international tie in an airport. So you're talking Atlanta, LaGuardia, O'Hare, you're talking LAX, you're talking Miami International, Dallas, Fort Worth. Those are all international gateways, and we know that there was penetration within our population months before. Okay, so in New York, why is it they didn't have this huge stream to the hospitals and the huge stream of death that they experienced prior to March? What about all through February? Now you can say, well, we didn't know, we weren't testing. Well, the hospitals would know. If you had people in fatality, you would have had a resurgence to the hospitals. So that, again, it's undeniable. The rate of spread, the rate of contagion, and the subsequent rate of death all escalated, and the only common denominator with the stay-at-home orders. Why am I bringing that forth? Because that's the story that's not being told. And if we don't recognize the errors that were made, then we are doomed to repeat them, especially now when most top infectious disease experts warn us that even if we get beyond the curve, the apex, the plateau, whatever you want to call it, and we get into a more manageable downward slope, there will be another resurgence. Some are saying it's coming in winter, that this is going to rise again. So now becomes very critical as to how we manage that space of 6 to 10 feet between us as humans, not just strangers in public. Another thing to reiterate, how it's undeniable the stay-at-home orders were much more detrimental than they were positive. Why is it, case in point, in South Florida, in the peak of spring break, where you had kids in college and people and everybody out there in February, and they finally shut that down. However, all through February, where was the stream to the hospitals? Where was the flow of sick cases and people recording deathly being ill in their homes and all that? Didn't happen. Not in any large-scale numbers. And in this particular state of Florida, the governor didn't issue the mandate to shut down until April 1st. It actually went into effect April 2nd. So right now, you can check the numbers. We are actually in the third week. We are in the peak week. And coincidentally, this last week, third week, we just surpassed 1,000 deaths in Florida. And we just hit, of course, an exponential peak in infection rate. So again, I want to deal just with the facts, but I want to share them with you, the public, and anyone else. This is for government officials. This alert is for everybody, because misinformation, to me, can cost lives. And the way I bring this home for anybody to understand is I've done a little personal survey myself, and I'm going to share a little experience with you. I got on talk radio the other day. It was late at night. It was on my way home. I was working late at the medical center doing research on this actual project, and I called into a conservative talk radio down here called WIOD 610, and they go to screen you. So he asked me, what are you calling about, sir? And the topic was on COVID, but he wanted to know what angle. They want to screen you, make sure you're not some drunk calling in the middle of the night. So I said to him, well, let me ask you a question, which already took him aback because they're usually trying to control everything. I said, if you were coming home to your family, and for whatever reason, they give you a random test at work, or you didn't feel right, you stopped at the hospital, and now you tested positive for COVID-19 before you got home, what would you do? And I hit him flat-footed. He was like, there was a pause. And he goes, well, I don't know. I guess I wouldn't go home. I said, you mean you wouldn't go? Yeah, no, I'm not going to go home and endanger my family. I said, I'd probably check in or at a hotel. I go, great. Now, second, by the way, that's the number one most popular answer I get from everybody. And I've asked patients, I've asked doctors, I've asked attorneys, I've asked everybody I know, because I wanted to know their first reaction. And it's the first number one reaction. Second number one reaction, if you're not in the economic status to go to a second property, check into a hotel, because there's a lot of things that would be racing through your mind, obviously. Second number one answer, though, is, well, I'd call ahead to my wife and make sure that they start to prepare a separate room, or put me in the kids' room, or shift over, put the kids in with the wife, and they would quarantine me off. And they would make sure, and then we would start doing plans, I guess, where we don't share the same. I said, exactly. I said, what you're outlining right now is actually a medical protocol on how to distance within your home. Does that sound fair? And he said, yeah, you're right. And right away he said, you know what? He said, I didn't think of this. He said, hang on, let me put you through to the host. Normally on this talk show, each guest is given maybe a 2 to 3, maybe if it's interesting, a 5-minute window. They didn't let me off that show for 22 minutes because I struck a nerve that nobody had anticipated. Nobody was looking at this. And yet every single person I've asked that question all gives the same answer. So if you doubt, and the whole key on this is you would have to do these measures to distance yourself because of the absence of what? The absence of a medical test. So you can immediately test your family, your wife, your kids, to make sure that everybody's safe. So in the absence of testing, and one physician that was on the news this last week said it, her language, her choice of words was excellent. She said, this is a blunt instrument, but it's all we have. And yes, in the absence of testing, you have to use physical space between human beings to establish, at least for the critical time. Now, I was sharing this with one of our top physicians. He happens to be an ER doctor out on the West Coast. And when he spoke with me, he got pretty aggravated and adamant. He said, Guy, he said, I've got colleagues that have moved into the garage for the last 2 weeks, put in a portable AC in the garage to separate from his wife and kids. He said, because we know without the benefit of testing, I'm not going to endanger my, and I role played with him. I said, Well, doc, I said, that sounds kind of extreme. He said, why? He said, what would you do to save your family if you felt your family's life was in danger? You're telling me you wouldn't go to some extremes? And he said, by the way, we only have to do this for 2 to 3 weeks, 4 weeks max if you want to go overboard. He said, in the absence of testing, what we're simply doing is we're isolating ourselves off from the most important person, and that's our family. And that's when it struck home with me. That's when it really struck home, and I thought, yes, this is very true. And he put it this way. He said, well, they're all putting this emphasis, and authorities put all this emphasis, and that's where he got angry. He said, all this emphasis they put on the importance of social distancing the minute you get out of your house, as if they think the minute you step out of your house, the virus is some bird that can swoop down on you and suddenly infect you because you exposed yourself to the outside world. And he said the virus doesn't work that way. The ideal conditions for the virus is simply human to human and breathing on each other or sneezing on each other or contact sharing. That's how it's transmitted. He said, so let me ask you a question. With all the advice on how to social distance, is it not more important that that emphasis is put on indoors with your most important people, which is your loved ones, rather than putting all the emphasis on the outside? He said they got it reversed, and that's where his anger rose up. He said, and we tell all our patients at the ER that we have to send home that may be positive or not positive because if they're exhibiting symptoms, we have a large percentage of them that test negative, meaning we have to officially tell them the test results. By law, we have to tell them, you tested negative. We have to send them home. As a precaution, you know what we do? We give them these exact protocols to follow when they go home so that they quarantine themselves off from the family. And then we tell them to check in every day to monitor their symptoms. And then you know, if you haven't been aware of this, the existing protocol to follow is the hospital releases you from the grips of the disease and calls you recovered if, number one, you're showing no symptoms, but number two, 2 negative tests in a row. So you understand, this is a fluid process that's affecting everybody, and I wish I had a one answer fits all, but one of the things going forward that we must be almost militaristic, religious, whatever you want to call it, you must exercise distancing with your most cherished loved ones, at least for that critical 2 to 3 week period, until you can identify and make sure that your family is not exhibiting symptoms. And then in best case scenario, you're finally issued that serology test, which is much more accurate and also establishes whether you have had the antibodies or have antibodies, or if it ever had been occurring in your system, which is actually by epidemiologists and infectious disease experts and medical doctors have all confirmed with me is the most important test for 2 reasons. One, it establishes whether you might have an immunity, and number 2, it establishes if you do have that immunity, a much higher percentage of safety margin to go back to the workplace. And those serology tests are vital to all frontline workers. That should be established, number 1, to healthcare workers. Number 2 should be first responders, police, firefighters, anybody has forced interaction to keep the public peace. Then you start getting into grocery workers and food workers and everything else. And then I want to close out this update by telling you further edification of what we found is going forward what you're going to see. Because while everybody's in this lockdown, which was brought upon you by no action of yours, this was all out of your control. I'm talking to you, the public. You were brought into quarantine, lockdown by your state governors and by your federal agencies, and it was admonition from the top all the way down. And when they close businesses, that's out of your control. But what you're going to find, and listen, this is going to bring up a subsequent anger. And it's like the old saying, and I'm talking to heads of households, and it's not a sexist thing, it's male and female. You're going to get angry when you realize that when they reopen businesses, and like restaurants are operating at a 20% capacity and doing measures that I suggested in our protocols of 1 hour time frames, you're not going to be going into a restaurant and hanging out for 3 hours. This is where life is going to change. And this is where you have to start thinking beyond yourself when you're out in the public. Okay, so they'll have 1 hour, maybe 45-minute time frames for a restaurant, and you're going to see a new thing where you're going to have partitions and one for another, hopefully clear partitions, separating people off in the restaurants. And they're going to be extended hours, I would guess. Or restaurants will be open longer to take up for the 20% factor to help the business get more volume. Okay, you won't have the same number of staff in the restaurant either. You won't have the same number of staff. You're treating 20%, you'll need less staff. in the restaurant. You'll need less staff in the kitchen. These are just common sense measures that you're going to see implemented in your communities. Theaters, same thing. 20% occupancy, less staffing, perimeter governance from the perimeter of the parking lot. They're not going to allow everybody to just park. They're going to omit certain number. It'll take longer to load the theater. All these measures are going to be placed. But here's what you're going to realize, and it's going to raise an anger. You're going to say, well, if they're doing this now to reopen society, then you're going to suddenly realize, based on the numbers that were coming in the very beginning, and we're only talking about a month and a half ago, they never had to close down society. They could have instituted these mitigation factors and let businesses continue operating. And why did I accent restaurants? Because it's the second largest employer in the country. You're talking millions of Americans that were put out of work. And I'll leave you with one last thought. When I say the anger that's going to come up, I want you to get used to channeling that anger in a healthy way. Don't channel the anger into, breaking out and getting into possibly a violent protest. We need to channel our anger in a constructive way. Channel it towards making a more strong commitment toward organizing your family to be on guard, to be vigilant, to make sure you limit. Once you've established, by the way, the safe zone within your home, you get past that 2 to 3 week cycle where you've isolated and you've made sure every member of the family using kitchen shifts, bathrooms, whatever can separate you in a practical means. Remember, you just need to do this 2 to 3 weeks, 4 weeks max. Once you've established the safe zone in your family, then the outside social distancing becomes important. And then what you do is basic things like one person goes for essentials. Again, this all is hopefully temporary until proper testing can be in place and as you see businesses opening up. Okay? But you're going to realize very soon when they open up businesses on these limiting factors, had they done that a month and a half ago, they would have done two positives. One, they would have had an even less occurrence of infection rate and death rate from the public sector. And because they weren't sending you home in an inordinate exposure at home, remember one of the biggest reasons the virus spread tremendously through cohabitation spread, the title of our last video, is because now you had people at home for 1/3 longer than they normally would. Now, if you really wanted to get into details, in a normal family of 4, you're sectioned off for 8 hours at sleep time, unless you all sleep in the same room. So you didn't have high exposure during, there's 8 hours gone. Then, if you were going to work as normal, the 2 key members of the family were separated for 8 to 10 more hours. That only left an 8-hour quadrant when you were exposed to each other. When they shut the businesses down, they compounded it and they doubled it. Your waking hours, you're together 16 hours on top of each other. Some families, under this false sense of security, brought other members of the family, brought in-laws over. Hey, we got to hunker down. Let's get the board games out. We're going to have to do video games and everything indoors. We're going to do calisthenics indoors and all this stuff. And they didn't realize families were congregating and authorities censored that, promoted that, enforced that, again, without the benefit of testing. So, not debatable. They sent everybody home without knowing who's infected, who's not. And that is why the importance of testing is everything. Hey, it would be great if they found a way where the minute somebody was infected, they would get a glow in their face or their hair would change color. So you could immediately identify, oh, that guy's infected. Let me back away from him. Or remember the old board game operation where when you went down to touch, if you just touched a little side, it buzzed? That'd be great too. If every time we got within 6 feet, so the buzzer went off, said, oh, you're too close. We don't have the benefit of that. You understand? So we have to police this ourselves. And I got news for you. Unfortunately, the testing rate is not going to be near anytime soon on a grand scale where you can immediately just run out and test your family. From all the experts are saying now, that's not happening. And that's what we need to properly and clinically safeguard. So you have to do the next best thing. And that's exercise distancing as best you can, both outside and inside. But our whole measure and our whole mission is to get this point out that what they got backwards is the importance of distancing within your homes is much more important than what is already second nature, and that is to keep your distance from strangers when outside the house. You do that anyways. It's just now with COVID, it's a natural thing. Instead of maybe being 3 or 4 feet from the guy at Home Depot, you talk to him from 6 feet away. And guess what? He's used to that too. He's already wearing a mask and he's backing off from you. The transmission was never out in public. And we need to accept that. With that, I want to say, please be safe. Please be conscious of family first. Use exercise measures as you can. When authorities allow you to reopen, don't just religiously follow what the authorities are saying. Have a second common sense nature that drives you from now on. Because we should have learned from the masks. We should have learned from them now telling you that it's not just from coughing and sneezing and telling you that now just somebody breathing. We should have learned from those errors not being updated for 6 weeks. For 6 weeks, you went on the feeling outside that you don't have to wear a mask unless you're a healthcare worker or you feel you have symptoms. Now, 6 weeks later, they're telling you, oh, everybody has to wear a mask. So you need to understand that what you're always told on national television and these so-called authorities, they don't know. Let common sense rule. And as I stated in the beginning, space management is now the final frontier. Thank you.